Welcome to the top 10 misconceptions about anxiety. In this video we'll be going through the current myths that cloud this subject, so you can all get a better understanding of what you, or someone close to you might be going through. Myth number 1. Anxiety isn't an actual illness. You may not be able to diagnose anxiety with a blood test or X-ray, but abundant evidence has found that, like other mental and even physical conditions, anxiety disorders are diagnosable medical illnesses. The good news is that they are also manageable with tools like psychotherapy and medication. Anxiety disorders are a type of mental illness based on extreme fears. Feelings of anxiety include fear, worry, and nervousness. Experiencing some anxiety from time to time is normal for everyone. However, it's still an illness that can be treated. Myth number 2. Anxiety is just a phase. Stressful circumstances can definitely contribute to your racing thoughts and fast heartbeat. But if your anxiety symptoms outlast the difficulties you face, and feels like a constant cycle that just keeps coming back around, it's likely that it's not just a phase. It's very possible you actually have an anxiety disorder and that you could benefit from medical treatment. Anxiety disorders can produce an ebb and flow of symptoms, so it's important to work with a healthcare provider to identify a treatment that can help you remain symptom-free and function in your everyday routines. Myth number 3. Lifestyle changes can cure anxiety disorders. Doctors often recommend lifestyle shifts, like getting more exercise and eating a nutritious diet to improve a patient's overall health, getting fresh air, or just being outside, and there's evidence that these practices can help reduce symptoms of anxiety. But a workout regimen and a special diet may not be enough to stave off someone's anxiety symptoms. Just know, needing more than just food and exercise doesn't make you weaker. If you're struggling with ongoing anxiety that's interfering with your everyday life, a medical provider can help you figure out other ways to feel better. Myth number 4. Anxiety and panic attacks are dangerous. When you're on edge or panicky, you might feel like you're about to faint, have a heart attack, or, worse, die. The physical sensation of anxiety can feel overwhelming, but luckily, it's temporary and not dangerous. Having the right tools to cope with anxiety and panic attacks, whether that is support from loved ones, exercises from a therapist, or mental health medication, is one way to empower yourself in those moments. Just know, it's temporary. Myth number 5. Anxiety is just part of life. While an in-the-moment panic attack isn't likely to harm you, anxiety, if left untreated, can pose risks to your mental and physical health alike. On top of interfering with activities that help to keep you healthy, like sleeping, exercising, eating well, and spending time with friends and family, anxiety can also result in physical symptoms like stomach aches, headaches, and muscle pain. Chronic stress, even in the form of anxiety, has also been shown to increase people's chances of developing a chronic illness, including heart disease. Bottom line, while it's common to experience anxiety, you deserve the care you need to overcome your symptoms. Myth number 6. Anxiety is impossible to treat. Perhaps the hardest part about treating anxiety is taking the first step, seeing a healthcare provider. Once you ask for professional help, you'll be surprised by the number of options available to treat your condition. Along with psychotherapy, there are many anxiety medications shown to minimize anxiety symptoms, and you and your healthcare provider can figure out which one is appropriate for you. Myth number 7. Self-medicating can help anxiety go away. Smoking, drinking a couple glasses of wine, using cannabis, or even zoning out on Netflix or just watching TV might make you feel calmer in the short term. But these forms of self-medicating are not an effective or safe long-term solution for mitigating anxiety. In fact, substance use, of alcohol and drugs, can actually make mental health conditions worse, including anxiety. Myth number 8. People with anxiety should just avoid things that make them anxious. Whether you get anxious about big group gatherings or you have a specific phobia, you may be tempted to avoid the situations that make you feel worse. While that's understandable, Avoidance can reinforce your anxiety and prevent you from doing things you want and need to do, which may make you feel worse and more anxious over time. Getting the care you need for anxiety can help you re-engage with life in a more rewarding way, even if it feels scary right now. Myth number 9. Getting anxiety medication is a hassle. Navigating the healthcare system can feel, and often is, overwhelming, which can temporarily worsen your anxiety. If you can't get an appointment with a psychiatrist or you're nervous about broaching the topic of mental health with your family doctor, you're not out of options. You can speak to a friend or a close family member and ask them for advice on what is the best possible action for your needs. You can also research medication online and seek out testimonials from reputable people. And myth number 10. Anxiety is just worrying. Persistent worrying and racing thoughts are part of the diagnostic criteria for anxiety, but there are several types of anxiety disorders that can affect people's lives in other ways. For example, obsessive-compulsive disorder, OCD, social anxiety disorder, specific phobias, and panic disorder are all types of anxiety disorders. Mental health providers, like the psychiatrists and psychiatric nurse practitioners, are experts at helping you identify what condition is contributing to your anxiety and finding a solution to help you feel more like yourself. You are never alone in your daily struggle with this illness. There is always help available to you. You've just got to want it and believe in yourself. Thank you for watching the top 10 misconceptions about anxiety. We hope you were able to learn something new and that you will share with others so they might seek help. Until the next video. Thanks again for watching.